united on this. Stamp out rightful assassin of our youth. You can do it by bringing about compulsory education.
Thanks for joining us again, guys. We are on episode 6, believe it or not. And this week we are joined by Seb Bishop, who is not only a medical patient himself, but also the CEO of Pura Health Medical Cannabis Clinic. So thanks for joining us, Seb.
Thanks for having me.
Yeah, really happy to have you here. So straight in with the first question, I think, Bruce, if you're happy with that.
Yep, let's jump right into it. So the first question is just learning a little bit about you and your personal relationship with cannabis and how it fits into your everyday life.
Sure. So I guess like most people, I started off cannabis recreationally at an age that was far too young. I smoked it when I first went to the UK. It was very hard to get in Guernsey. I didn't have many friends that could get hold of it. So I went to school in the UK and discovered cannabis. Kind of went through my life using it on and off when I could get it, and probably used it wrong. Did it after drinking, after parties, and did it probably as an escapism from life as a teenager growing up, suffering with anxiety, issues around school, and that sort of thing. So I guess it never really had a positive, secure spot in my life until recently, until it became available medicinally, legally, in fact, not medicinally, I think just legally. That allowed me to look at cannabis differently and consider it for other uses. Mm-hmm. And perhaps to consider why I was taking it as well. I think I was probably self-medicating cannabis without realizing it for sleep, anxiety, depression, and because I wasn't able to have a solid use of it, it was very sporadic on and off because it was the illicit industry at the time when I was growing up. It was never done in a controlled manner over a controlled period of time at a controlled quality, and done, I suppose, in a positive light. It was always something that I knew was illegal. It was something that my parents didn't like. It was something that society didn't like. So my initial relationship with cannabis was bad because cannabis was illegal. And I was scared of getting in trouble. However, it was clearly helping me get through my life as a young man. So I suppose the point I was trying to make was that my cannabis use has dramatically changed. The way I use cannabis, what it does for me, what it does for my mental health, it has changed completely from when I first used it. And I think that's to do with it becoming legal. Mm-hmm. Not fully legal yet, unfortunately, but legal from a medicinal standpoint. So that has then allowed me to look at it from a medicinal perspective, which has changed the way I use it a lot. And I'm still changing the way I use my cannabis, actually. When I first started using it medicinally, I used it for sleep issues, insomnia, restless leg. I was on all sorts of horrible medications for my restless leg, and massive depression and anxiety. So I was on every single SSRI under the sun. Mm-hmm. And cannabis has helped me massively get off all of these things, which I never would have thought would have been possible at the time.
Fantastic. So having that understanding of how it helped you then, how did you then become involved with Pura Health? Is that like a leading on thing? Or?
So I guess so. 2 years ago, I started my medical cannabis journey, and it changed my life. As a side effect of my medical prescription, I ended up quitting alcohol completely. I didn't see a use for it because I was medicating in the evening for my restless leg and my insomnia. It ended up becoming kind of at the same time something that calmed me down in the evening as well. So therefore, I didn't need my glass of wine or any other things to help me get off to sleep. So sorry, I've actually forgot your question. What was the?
So how did it? So yeah. So I'm understanding.
Oh, so yeah, going into it was into Pure Health.
Yeah.
So I started off, like everyone else. I knew cannabis was helping me. It became available medicinally. So I went down that route. I saw a GP. I thought I've tried every avenue medicinally in the mainstream. Let's try cannabis. So I started to try cannabis medicinally, and like I said, it changed my life. I've lost 5 stone. I've quit alcohol. I'm now off all of my medication. I've been interested in cannabis my whole life. It's been a passion my whole life.
Mm-hmm.
I've been into it my whole life. I've researched every single element of it my whole life. While alongside that passion for cannabis and how much it's helped me, I've unfortunately been working in the finance industry, rotting away, doing something that I'm not very passionate about. I've tried cannabis. I went into cannabis medicinally, and it then upscaled that again another level, because before I was having illicit cannabis, and amazingly, even though that was full of all sorts of rubbish, it was still benefiting me, from a medicinal perspective. Then when I went on to medicinal cannabis, that was then another level of wow, this is really helping me a lot. I've got sleep now. You're seeing me now 2 years on from solid sleep. Had 2 years of solid sleep, which is massive. If you've ever dealt with insomnia and restless leg, you'll do anything to get sleep. And that's what I was doing. I was self-medicating with alcohol. I was a borderline binge drinking alcoholic, I think, So when I went onto the medicinal cannabis, it opened my eyes up again to sort of, yes, there was a reason I was so passionate about this. There's a reason I love this. And it was helping me, and now it's really supercharged, what it's done for me. This was while I was rotting away in the finance industry. Mm-hmm. So it set me off. It set me off on my journey. It set me off on a journey of health, and that just made me realise, yes, this is something that we need. This island needs. This is something that the world needs. If this has helped me so much, just think what it can do to other people. Just think how many other alcoholics are out there. Just think how many other anxious people are out there on these horrible SSNRIs. So basically, I started talking to Tina, who set up Pura, and I said, look, I'm passionate about this. This has changed my life. I'm in compliance in the finance industry. There's a horrible sort of, the whole finance industry is poo-pooing this, and I keep on trying to tell people, look what it's doing for me. Look what it's doing for me. And it often falls on deaf ears, but I realised that people were actually starting to listen to me within the finance industry. And initially they were a bit shocked. They were sort of like, oh my God, you've got a compliance person talking about cannabis. What is this kind of thing? So they initially freaked out, but then when they started talking to me, hearing my story, I started getting across to people, how I was using this. This isn't a toxic way I'm using this. I'm using this in a very weighted, safe way. You have your glass of wine in the evening. This medication that's stopping my anxiety and stopping my restless leg has now become this. And as a side effect, I've quit alcohol, and I've quit all my medication, and look at me, look at this, So it just lit a fire up my arse and just gave me all this passion. So I started approaching Tina, who set up Pura, and saying, look, I want to get involved. How can I get involved? I'll work for free. I'll help you. Let me help. So part of it, I guess, getting out of my slump, and with all this passion, I thought, look, let's give back. Let's try and help people. And a clinic and the medicinal cannabis, I thought was the best way to start. Like as you all know, I think that eventually we need to just come to terms with the fact that it has got use recreationally and legally as well. But at the moment, I've got to draw a hard line on the medicinal side, and medicinally it helped me massively. And that's why I'm here, and that's why I'm doing what I'm doing, because I'm passionate about this, and it changed my life.
Fantastic, driven through empathy. This is brilliant.
Yeah, empathy and passion, and you've got to try these things. If you don't try, then you don't know, and that's what I want to tell people. Look, this can happen. There's negative sides as well, but the positives well outweigh the negatives for me personally, and that's why I'm here today, and that's why I'm so passionate about this.
Yeah. So up to this point now, you've met Tina. You've discussed your journey with her. She's now brought you aboard as the CEO of Pura Health. So can you kind of just walk us through a typical day at the clinic and what your role is in the daily operations?
Sure. I mean, at the moment, I'm running everything. Our clinic manager's on maternity, so I'm sort of managing the clinic and trying to sort of push things forwards in the background. Let's start with a day in the normal clinic.
Yeah.
So we've got patients. Hey, we've got 300 odd, 400 odd patients that we care and we look after. They all need different types of medication at differing levels. They all need different levels of service. I like to think that we offer more services than we actually charge for. But effectively, look, it's a clinic. People see our GPs. So GPs need to be booked, arranged, organised. Prescriptions need to be written. Clinics need to be undertaken. We need to get the doctors into the clinics. We need to get the patients booked with them. That has to happen pretty quickly. We've got a lot of patients, and it's a short space of time. We need to, within that time, really, care about the patients and hear them as much as possible. So it's very important. These clinic times and this organisation. So I suppose I start off looking at my emails, making sure that I'm dealing with anything that's urgent, phones, and there's so many moving parts. It's ridiculous. The clinic is kind of the first point of call where everyone comes to, but in the background we've got the cannabis suppliers, we've got the pharmacy, and we've got the GPs. These are all separate entities from the clinic. We have to employ the GPs, we have to do business with the pharmacies, we have to arrange business, we have to make sure that we stay afloat. I'm trying to think of the best way to sort of answer this question, a day in the life of the clinic. The things that I'm trying to do in the background, for example, is I'm trying to increase our formulary. There's all these different strains of cannabis out there, and we're prescribing it medicinally. So one of the challenges is the quality of the cannabis, getting the correct quality. Then the next challenge is the price of the cannabis. This stuff's really expensive. There's a lot of expensive rubbish out there that you've got to try and sift through. So there's lots and lots of challenges. So like it's almost like a normal everyday GP practice,
Yep.
Except we have to find the drugs, we have to find the medicine, and we have to find the healthiest medicine we can at the right price. This stuff isn't subsidized. So I see, we are a not-for-profit. I see us as almost a charity here. There's a lot of greed in this industry. There's a lot of greed in this industry, that is our mission, is to try and stay afloat. That's why we are a private clinic, but we're a bit different. We're not trying to make loads of money. We're just trying to stay afloat, and that is a challenge. So my mission is to try and glean as much income, educational income for the clinic from the many of the players in the market as we can to keep ourselves afloat. Because all of these other players, like I say, they're all hungry for this. And it's not necessarily their fault. They've had to invest lots of money in this industry, so they're in massive debt. So they do need this money, and they, unfortunately, because of the way this whole system is set up, people are in it for a lot of money now. So they need to get this money out. So I see my challenge as making sure people aren't ripped off too much, taken advantage of too much. They're not overprescribed. They're doing it for the right reasons, and we're looking after them for the right reasons. I hope I answered that enough. There's so many, we're trying to educate. I'm probably answering some of your other questions here in here, but one thing that I'm trying to change is how the formulary that I do have. at the moment, unfortunately, and this is something that you might want to ask some prescribers, for a bit more detail. There are courses that our prescribers take, specialist courses for prescribing cannabis. I'm not a prescriber, so I've not gone on one of those courses. But to me, at the moment, the way that things are prescribed, it's done on a sativa dominance basis, an indica dominance basis, as you guys all know.
Yes.
And then if we're lucky, and we are, we understand it. Our doctors have a good understanding of it. A balanced one, and that is not fit for purpose. And it because of terpene profiles, and the science of the terpene profiles is getting there, but it hasn't fed its way through to the prescribers yet. The challenge is to prescribe the right medicine for the right condition, and the GPs are trying to do that, and we're trying to do that, but because there's nothing sort of set in stone, and it's up there. There's not necessarily. This is a natural plant. It's not a pharmaceutical. So there is a little bit of investigative work that needs to happen, and that's something that we're trying to bring to the table. We're trying to educate our patients on terpenes and how terpenes affect your mood, your health, your information, your positives, your negatives, and that is something that is a big challenge and is requiring us to really focus on the information that we're able to get from the flowers that we have and what their terpenes are. So I'm going off on one a little bit here. So sorry.
You're fine.
We run a clinic normally, but we've got ideas. We've got things that we want to do.
Do you find, just kind of touch on indica sativa thing? So at least from my experience being in the shop, I do talk with a lot of patients. I do find a lot of patients that are finding, I've been prescribed this sativa for during the day, but it makes me sleepy. I've been prescribed this indica for at nighttime, and it's keeping me up.
Yeah.
To me, that is misprescribing the product. Okay. How often do you find this with patients coming to you saying, well, this isn't working for what it's intended to, what I was told it was going to happen?
So when they say, in terms of what they were told was going to happen, they wouldn't have been told what was going to happen, if you know what I mean.
But if you're being told sativa's daytime and indica's nighttime, then
yes, so that's
walking away saying, this is going to keep me uplifted all day and this is going to make me sleep, but they're experiencing opposite effects.
Yes, yeah. So I suppose I am the one that often talks to patients about this. So they'll initially come to me and they'll say, oh, look, I've had this, I've tried this now, and this is doing this and this is doing that. I can then offer them a little bit of guidance from personal experience.
Sure.
And my guidance is, look, everyone's different.
Yep.
Some people will react to a terpene literally the carbon opposite of me. In fact, I've got a friend that's a really good friend of mine. I know if she likes something, I won't. If she says, oh, well, that made me feel great, I know that will actually potentially give me a bit of anxiety. It's the wrong terpene profile for me because I'm a different person to her. Sure. And everyone's different. And this is a big issue. In my opinion, this is a big issue. And we do try and help people with it. And I am trying to work with our prescribers on this front. They've got to go on the guidance that they've been given. And we care about the patient, so we want to try and merge the two together, regardless of whether what I'm saying is, if the guidance is not correct there yet, if it's not there yet, we still care about the patient, so we can still listen to them and change things. So to answer your question, I am trying to update my formulary and our offering to focus more on terpene profiles and the effect of those terpene profiles. If GPs at the moment and doctors need in their head to compartmentalize them into sativa dominant and indica dominant and balanced, so be it, but I would like them to also put weight on the terpene profile alongside that.
Just a basic understanding.
A basic understanding, yeah. I think the reason it is done as it is to simplify things, because this isn't simple. And when you're prescribing as a doctor, it has to be relatively, they have to make, and again, I'm not a doctor, so you need to, ask I'm making assumptions here potentially, but they've got to have some basis. So their understanding is that sativa dominant strains generally will be more uplifting from a terpene profile perspective. Now, whether that's correct or not, that doesn't change your point, which is why someone might react differently to that still. So again, medicine and everything has got to go based on the majority. The majority. So if the vast majority of sativas are uplifting, the vast majority of them people will be uplifted by them. They've got to go they're going on that route. I think what needs to happen and what we're trying to do is, when you've after that point, you now then talk and listen to your patient, have follow-up consultations and listen to them. And if they are having different reactions, they should be respected. We should respect that. And we should allow them to try an indica or a hybrid or something else for that day. So, and our prescribers are starting to get more comfortable with that. Provided there's a good reason for it and an explanation. So like I said, so that they will go on the initial guidelines that they've been given and that they have to follow, but they are open to listening to the patients very much, and will tweak it after. So we do prescribe hybrids for people in the evenings and the day. We don't just do indica, for example. And some of our patients that understand what they're doing are able to have within reason, what they want. So if they're saying, look, this low THC sativa is better for me in the evening because the terpene profile of this particular strain happens to make me tired, I don't think that should be a barrier to entry for them trying it. But there is a good reason for it, though, and that they're cautious around it. And from my opinion of that is that it is actually the more uplifting strains and the terpenes, because that is where you're getting terpenes that can potentially make some people's heads racy and other people's really focused and beautiful and amazing. That is where anxiety happens and a panic attack realm happens. So doctors are understandably cautious in that area, and that's why I think you'll see in the whole industry overall, sativa dominance or uplifting dominant strains are less prescribed.
And I find that to be a problem, in my opinion, is because I'll use myself as an example, is terpeneling, which is the main one in Jack Rare, right? And that is a sativa plant. Hybrid, of course. That terpene and that strain tends to give me anxiety. Now, somebody else would use that strain, get anxiety from it, and say, I can't have sativas anymore.
Right?
That's a problem.
Yes.
Because it happened from one specific terpene, or it possibly happened from the THC, because there wasn't enough terpenes in there to reduce the anxiety from it. But to cut off an entire species of plant from one terpene, that's where I see a problem.
Totally. Yeah.
And then I think the first step in veering away from this indica and sativa is realizing that there are no indicas in sativa. Everything's a hybrid.
Yeah.
We did to cannabis the exact same thing we did to dogs. We crossbred them like crazy. And in doing so, we did benefit from that, right? We strengthened the genetics. We created more diverse terpene profiles on the plant, which is a good thing. But we need to be looking at those terpenes as opposed to the plant morphology.
Yeah, and
Right.
from a medicinal standpoint, the plant morphology is a moot point.
Exactly.
It means nothing. And especially given the fact that they're all hybrids, it's a moot point. Yeah. Like I said, I think really it is just the industry's best efforts at the moment. And let's remember, this is the medical industry trying to understand and integrate with the cannabis industry, which you and us, we understood because we've been doing it since we were children, since we were young. That's not correct either, though. That's another thing. That's why I want this to be an open conversation, because we should be openly talking about this around our children, saying, I just wish I'd waited till I was 21. I just wish I'd waited till my brain had fully developed, and then when I was an adult, of course, have at it. You know, that's the problem. You know, we talk about these things around. I was just literally at a party the other day talking to a parent, and suddenly he stopped. And I was like, is everything okay? And it was because his son, who was probably literally 14, the perfect age to have been there, started eavesdropping on our conversation. And literally he said, I don't think we should talk about this right now. And I said, no, I think the exact opposite. We should be talking about this, but we should be talking about how we did it when we were too young.
Yeah.
Because that's the exact age right now that he's going to want to do it. And if you don't give him the decency and respect to communicate with him about that, he is going to go off and try and do it with his friends anyway, behind your back.
That's it.
And he's probably going to do it dangerously. And, he's not going to be able to get hold of cannabis because it's not easy to get hold of. And he's going to end up trying to self-medicate with some other horrifying thing that he's learned on the internet and get him high.
So, yeah, that's the whole shout of trying to get off the streets.
Yeah, yeah.
So, well, going back a little bit then, so you're obviously, your career coming from finance and specifically from compliance. So how do you ensure compliance with regulations when it comes to things surrounding the cannabis?
So regulation is an interesting one because there isn't much regulation around, prescribing at the moment. We are trying to make regulation. You know, we are trying to talk to the powers that be and have a discussion. And they are talking to us. To be fair to them, you know, they are coming to us, asking us, say, you know, what are your opinions in this industry? How do you think it should be regulated? So we have already been asked, and we have already put forward our opinion on regulation. So in terms of regulation, you know, like I said, there isn't much regulation at the moment. We self-regulate, basically. You know, there are guidelines, and there are guidelines for prescribing. You know, like have to have tried 2 mainstream drugs first before you can try cannabis. Those sorts of guidelines exist. We actually try to follow those and go above and beyond. You know, effectively, it's all about self-regulating. We've got a controlled substance that can do great things for people. It can also do great harm to some people as well. And that is where we think regulation is extremely important. So don't just hand it out like candy to young men and women. That is not ideal. We need to have good reasons why we're handing it out, and that needs to be regulated to protect people. And a lot of the regulation, I think, needs to go not so much on the whole who can and can't have it. The regulation needs to be more on the quality of the cannabis, and the education of the terpenes, and then the science behind that. Because, you know, this medicine is amazing. You know, like you're saying, you know, I personally thought that I didn't get on with a lot of sativas, but then lo and behold, I suddenly try a sativa at Bruce's recommendation at Queen Sangria, lovely lady, best cannabis I smoked in my life, and that was a game changer for me. I was like, wow, okay, that's a whole nother power tool in use that I didn't know that cannabis could have done for me. But without, anyway, I've divulged it away from the regulation already. But no, the regulations are, I think, most important around the actual medication itself. There's not enough. It's Cowboyville out there. That we know, we try and stock non-irradiated flower that's ideally been organically grown in living soil. Now, that's quite hard to find. Yeah. Most of these players are, unfortunately, now the pharmaceutical industries probably have got their investment money in these things. They are mass producing ridiculously high THC cannabis at really poor quality. They're irradiating it, acid washing it, bleach washing it, and tumble cutting it, trimming it, or whatever. And we've got this horrible Franken weed in our packaging in a lot of the cases. So we try to self-regulate on that front by quality control. So whereas we do let our patients specially order, but that's a minefield in itself. Because unfortunately, people aren't educated 100%. They perceive that it's the THC that is the painkiller, is the making me feel nice aspect of it, and it's not. It's the terpenes. The THC is the drug element of it. THC is THC. It is one tiny element of this beautiful plant and this beautiful synergy and the entourage effect. And it's just the THC that unfortunately the industry, even the medical industry, seems to be focusing on this bloody THC thing, as well as and devoid of any CBD.
That's a result of the black market.
and which is yeah. But who would have thought that the medical industry would have carried on going down the black market route, supposedly the black market route of high THC? You know, I don't think the black market route. The only reason the black market route went to high THC, I assume, is because higher THC means you need less volume, and less volume means you're less more money, easier to distribute higher stuff. I think if no one cared about that, they would just want to grow really nice cannabis that tasted nice and gave you nice effects. But yeah, the regulation side of things, there's not much regulation. There needs to be way more regulation, but the regulation needs to be from a place of protecting patients' quality of cannabis, not let's just try and put regulations in just to stop people getting this medicine, because that is wrong. But I also do think that we need to be very cautious about how much we prescribe to people starting this. I don't see any problem with young people trying cannabis. What I see a problem with is young people, the first time they try cannabis, being given a ridiculous amount of really high THC cannabis. It's like instead of giving a shandy to your child at the table, you've given them neat vodka for the first time. Anyone knows that's bad. We regulate ourselves, so the first cannabis, unless someone's already a pre-existing cannabis patient, they are not going to get a strong cannabis from us, the strong THC one, for their first time. It's not needed. It's silly to do. Why would you do it? So we're having to regulate ourselves to protect our own patients. If we didn't, and we ignored it, and we just gave everyone what they wanted, one, that's not medicine, and two, we would get ourselves, I think, into trouble, and the whole industry would get ourselves into trouble. But isn't it great that the industry is trying to regulate itself?
It's true.
We could probably go off and start prescribing loads of stuff for loads of reasons if we were really, really wanted to, and some people are, unfortunately, but we don't. Pura does not want to do that.
So with the regulations, I do agree with you. There needs to be more regulation around it. But I also think the regulations that are currently around it need to be looked at again. Going back to you were saying where a patient needs to have to go to their GP, try a couple drugs first, right, before coming to use cannabis. But what do you do in a situation now to where Guernsey's law allows for a significant amount of THC in your CBD edibles? I have plenty of people that have come into the shop who use these edibles for medicinal purposes. They're using them for a couple months. They're realizing that they're benefiting from it. It's working. And now they want to come see you to get medical cannabis. And they're going to be told no because you haven't gone to a GP and tried these other drugs.
Yeah.
That's a problem when somebody's already been using cannabis and benefiting from it and then being told no, you can't be prescribed it because of that reason. That's a regulation, in my opinion, that needs to change. That shouldn't be.
Well, it's a problem for other reasons as well. How stupid is it to say you have to try 2 drugs on the mainstream that don't work for you and are detrimental to you before we'll let you try cannabis? It's like it's always like you have to mess yourself up trying SSNRIs, which, by the way, takes you 3 months of hell on those. It's a month to start taking it, then you've got a month trying it, and then you've got a month to get off it. And that's 3 months of hell when they don't work for you, and many of them don't work for you. So you're saying, right, sorry, mate, you're massively anxious. Cannabis will help you because you've tried some of Bruce's gummies, but we're not going to give you anything. You've got to go there, try this SSNRI, this SRA, probably, potentially have a mental breakdown and potentially kill yourself, because these things are horrifying, before we will even let you try a low-level THC natural plant that we know benefits lots of people, and we've got the evidence now. We now do have the evidence from our patients because we are asking them questions. We're seeing how they're doing, and we're physically seeing them coming in looking like living beings rather than alcoholic messes with God knows how many chemicals in their body. That's a terrible way, and I think there is the ability to not do this already now. So, and again, you've got to ask a prescriber this, because it's something that I've got to be careful of, because I don't understand this fully. But I believe if you are a specialist, so if you are a specialist doctor in psychiatry, or a specialist pain doctor, you can prescribe cannabis on your specialism.
Okay.
So if a GP, if one of the prescribing doctors is that, I believe on their own license, they can prescribe cannabis for someone in severe pain if they are a pain specialist, as in they have not had to have tried this and this and this. I believe that is an ability, but you need a specialist to do that. A normal GP can't do it. So like in the UK, you know, you would have a pain specialist that could flat out prescribe cannabis for someone, you know, that had broken their back if they hadn't tried so and so painkillers. But if you weren't a specialist, you would unfortunately have to adopt this process of you've got to try these two things first before we can do it. But what a strange way. Well, I think it's crazy. What I think isn't crazy, which is what we do, is we want to involve the GP. We write to the GP and say so and so's applying to us. Could we please have a summary? You know, we tell people that you know we want to communicate because we think that it can work a lot. You know, people should do this alongside their GPs, and their GPs should know about it.
I have heard of, you can correct me if I'm wrong, if this is true or not true, but I've heard of patients being prescribed for alcoholism to help them get off of alcohol.
Yeah.
Using cannabis. Now, if that is true, how does that work with them having to see their GP first and being on certain medications before they can try cannabis? And now, is that the loophole with being a specialist, being able to prescribe based on alcoholism without them seeing a GP for something?
So I think, and again, you'd have to ask a prescriber, and so we have got alcoholics that are prescribed cannabis. Now, they may be prescribed cannabis because they also take multiple medications in the background.
Okay.
I don't fully understand that, but my understanding is that if we had a specialist prescriber that was an addiction specialist, psychiatrist and addiction specialist, they technically would be able to prescribe cannabis to an addicted, someone with alcoholism, because that was their expertise and that was their specialism. But another doctor at another clinic, if they didn't have that as their specialism, wouldn't be able to do that.
Okay. Yeah, the reason I ask is because I do see a lot of patients that come up to the lounge here who say that they're prescribed for alcoholism, and the main reason they come to the lounge is because they have a place to come and hang out that's not a pub.
Yeah,
and
which is amazing.
It gives them a way to be social without having that having the alcohol in front of your face, basically screaming, drink me, right?
Yeah.
Where you can come here and use your cannabis and hang out and still have a place to enjoy.
Yeah.
You know, so that's where, I do get a lot of people up here doing, using the lounge for that reason, which is why I asked that question.
Yeah.
Because they have said to me, I'm prescribed because of alcoholism.
Yeah. And so like I said, so definitely I know that some people have been prescribed because of alcoholism. I just don't know whether there are other reasons that the prescriber has been able to do it, or whether it's just based fully on the fact that it's just that. But people that are suffering that badly with alcoholism very likely are going to be a member of CDAT or something. They're going to be getting other treatments in other areas, psychological evaluations, all these other things on the mainstream alongside it. But what's amazing is how much cannabis helps alcoholics and drug, and it is so funny. Hey, everyone's been talking about cannabis being the starting drug for everything, the gateway drug, which is sugar's the gateway drug. I'm sorry, then caffeine, then alcohol. That's ridiculous. But how cool is it, and how amazing is it that cannabis is used as an exit drug? It's an exit drug, guys. That's what we need to say here. People are getting off alcoholism, me included. I was a binge drinker. I wasn't an alcoholic, but I was a binge drinker. And Guernsey's full of binge drinkers. And I was a one-track ticket to type 2 diabetes, as many other people are. And I think that's one of the best prescriptions for cannabis is to help people get off alcoholism and opioids. And I myself got myself off alcohol, and then I'm now also weaning myself off the cannabis. So there's another thing, talking about cannabis being addictive. I'm sure that got mental addictive. Anything that's pleasurable that relaxes you is going to be mentally addictive. But what's nice is it's not physically addictive. Alcohol most certainly is physically addictive.
100%. Yeah.
Opioids most certainly are physically addictive. How great that you can get off these drugs with an acute treatment of cannabis, and then you can much easily taper yourself off the cannabis. You know, you can kill yourself accidentally tapering yourself off alcohol too quickly.
Yeah. When it comes to your inventory of medicinal cannabis, how do you manage that to meet patients' needs? Is that?
Yeah. So supply chain. So this is a massive thing at the moment, we do it slightly differently from some of our competitors. But to be fair to everyone, it's a minefield at the moment. Firstly, there's some new regulations that have come into place since July in the UK and Europe around cannabis and its requirements. So that has that's stopped a lot of people putting a lot of their products on the market at the moment. They're all sort of holding them back, to be compliant to then put them back on. So we've got massive supply chain issues at the moment, and masses of people are knocking at my door to try and sell me their cannabis as well. So we personally, I have a small formulary of cannabis that I try to stock. And my mission is to make sure between myself and the pharmacy that we work very closely with, that we've always got stock for people's medical prescriptions. Now, they have to order based on a clinical letter of needs or based on prescriptions. So a prescription can get an order, or a letter of needs can get a bulk order. So we try and bulk order our stock for our patients, and I would like to stock most of the stuff that my patients have, and I would like that to be based on terpene profiles and quality, and then price point. It's a minefield. We've got us, the clinic. We personally, as Pura Health, we're a not-for-profit, so we don't take the money off the patients for the flower. That sits with the pharmacy. We need to give the pharmacy a steer on what we want. The pharmacy then go away and do the ordering to the suppliers. The supplier often is an importer and exporter from multiple other suppliers. So again, there's another, there's a hub there, and then multiple suppliers are then feeding into that. So it's a minefield when we're ordering, basically. If any of my patients want to have a special order, I've got to put in at least an order in at least 2 weeks prior to something coming in here, and even then, it's not necessarily going to be in stock. What you've got hundreds of people growing cannabis and hundreds of clinics gobbling it all up all over the place. And 1 second something's in stock, the next second it's out of stock, 1 second it's live. It's saying we have it. You put the order in only to find out a week before the order's in, sorry, it's not available. It's a minefield. Also, the understanding what you're getting as well. Some suppliers are better than others. Some do tell you what it is. They tell you what the terpene profile is. They give you enough information, and it's good. Sometimes it's not. I'm trying to think of some. I could go through the entire process of it, but effectively, we've got to get the order from the patient. I've got to then write the prescription. I've got to then give the prescription to the doctor. The doctor's then got to make sure that the prescription's correct for that patient, sign it. I've got to then hand deliver it to the pharmacy. The pharmacy then have to put the order in. That silo then has to go to their importers and then put that order in. Then they've got to do the import-export licenses, and then we've got to somehow hope that one thing that we ordered gets here within 2 weeks. And it's tough.
Right.
Do you think, obviously we're all isolated here in the Channel Islands, being in the Channel Islands, does that affect supply chains and logistics?
The import-export, I believe, because we're getting this mostly from the UK, and even though it's coming from afar, it's coming to the UK and it's still coming to us. I don't think that a clinic in the UK needs to do the same thing as a clinic in Guernsey. Guernsey, we have to report, and I don't know, the pharmacy has to do some other stuff in their background as well. But I know that we're reporting for the prescriptions that we give out and the patients that we have to the States. And there are import-export licenses. And between the suppliers and the pharmacy, they sort that out. And then there are potentially fees as well. So there's potentially a slight increase in cost to getting stuff to Guernsey. And as far as I'm concerned, as far as I'm aware, there are more hoops. There are a few more hoops to get things into Guernsey, which is one of the reasons for these delays. The licensing is often the excuse that the supplier uses to me. Now, whether or not that's true or not, I don't want to put the licensing people under the bus for Guernsey, but all I know is we put an order in, it very often doesn't get here on time, and the reason is because of how many different players there are in that process to get the order done, and the fact that there's an import-export license. And it's great. It is crazy. Yeah.
Is there anything being done to look at the problems caused by the importation or the licensing?
Well, the thing is, the weird thing is, this import-export licensing was created back at the beginning of everything, and that was for individuals to import their own cannabis, and then for a supplier to export, to the person here. There are still people doing that, but now we're on a different model here. We're on the clinic. Now a lot of people locally go to a clinic with, in our example, with local GPs. So, and then the local GP is prescribing it, and then that is done in the background. So it is different now, but that thing in the background for some reason is still going on. So I don't understand why. So
Regulation.
Yeah, it feels like regulation on regulation. So, a person has to come through to see a proper GP, get a proper prescription written, go through a proper pharmacy, and everything's checked along the way to make sure it's above board and everything's logged and it's all put on the systems, all the due diligence is done, in Guernsey. Yet, in the background, there still has to be a weird import-export license to get that cannabis here for that person. It seems weird why that still needs to be the case, because why? Did they have to do that for normal medication? No, I assume that the pharmacy roughly works out what they're going to need, and then stocks it accordingly, not based on a specific import-export for an individual person or for an individual. But again, I don't, that side of things, because we personally as Pura don't get involved with that you might want to talk to the pharmacy about that element of it.
Does the import-export aspect of it, does that change or increase the cost to the patient at the end of the day? Because it seems that the UK market is a little bit cheaper than the Channel Islands market.
Yeah. So there's a few things there. So when you go on MedBud Wiki, it looks like sometimes the cannabis is much cheaper. Often you will get the price for that cannabis at their clinic. So when you see the MedBud Wiki price, it'll be 85 quid, for example. But actually, most people will have to pay 95 for that one. That's there. You've got to come to our clinic, mate, if you want this price. Okay. So there's that element that sometimes make people think that Guernsey is ripping them off, but that's not the case, if you know what I mean. So there is a difference. There's a difference between the MedBud Wiki price and the UK price sometimes. Okay. Between clinics, if you know what I mean. Some of the suppliers do charge us a fee. And obviously the pharmacies here do have to do what they have to do in terms of reporting numbers and figures to the powers that be, as well as their own administration. And then the import-export bit, the suppliers must have to do on top of what, because they wouldn't have to do that in the UK. Right. So they may well attribute that within their margin to the pharmacy, thus making it a bit more. I mean, we try to staunchly be not-for-profit, and I try to put mine on as a UK RRP. We might have to add a little bit on for the fees, if we get charged a fee or if the pharmacy get charged a fee. But there are other people that are profiteering more than that.
Yes.
Unfortunately, and there's no regulation around that. There's another regulation. Hold on a minute, I didn't think that we were all supposed to be profiteering off of this too much. we're a private clinic. We have to stay afloat. We've decided not to be not-for-profit. So it's fair enough for a private clinic to make money. I understand that. They're going to be able to make money, and they probably put in a lot of effort to get started, and debt and all that sort of stuff. But profiteering off medication is something that I struggle with personally, and try to keep, because I think this should all be subsidised completely.
Agreed. Yeah.
But I know we're a bit too early for that, maybe, as from the government perspective, paying for that. But
Too early to talk about it.
I don't think it's too early. No, I mean, I was just chatting to someone the other day. This person who's now on our books has now quit all their alcohol, quit all their medication. Now he no longer has to get Botox injections for stress and pain. Those cost our government £2,000 a pop, and he was having to get that every few months, the Botox injection. So he has actually approached social, and said, look, when I was on this other stream, this is how much I was costing you. Now I'm getting the cannabis privately. I'm now not costing you any of this. Could you please help me subsidise? He wasn't asking for the flower. He understands that he was just asking for contributions for the GP, and it's a bona fide GP. So what's the difference between him seeing a cannabis GP and a normal GP? It's still a GP, and the prescription fee. Again, prescription fee is a prescription fee. So he was saying, look, could you just help me with that? Because now I'm no longer costing you like hundreds and thousands of pounds for all of my other treatment here. And the answer is categorical no. Which, because cannabis is not considered something that they support.
Was there no conversation about it at all? It was just a flat no?
No, it was a flat no across the board. It's a shame. I was hoping that they would say flat no for the medication. I understand that. But seeing a GP that's a local, qualified, ours as a psychiatrist, why wouldn't you be able to subsidise that? Especially, you should be able to acknowledge this person now is alive, because he would have categorically been dead if he wasn't given cannabis, because he would have just drunk himself into death.
Yeah.
So one, he's alive. Two, he's not costing the taxpayer anything like as much money. But guess what? He's dying because he can't afford it. He's slowly putting himself into debt. He's having to choose literally food, heating out for this medication. And he said to me, if I stopped this right now, I would swirl into a manic depressive phase, and then I would go off on one, and I would be arrested. I would be put in prison. He knows exactly what would happen, and so does the GP. Hence why he's given him the cannabis to get him off all of these other stuff. So they acknowledge, it's obvious. They've acknowledged that yes, now he's not having to pay that, and yes, but they're not allowed to give him money for it either. So I'm sure that it's just not. There's no ability to do that yet, which is terrible.
It's really just common sense to do it.
It's just common sense as well. Yeah. You should be able to look at it from a case by case basis, and look, if you want to put extra rules and say, look, it needs to be a definite sort of mature person before we look at that, then fine, do it like that. The guy's 60 years old. He's not doing this to just get high. He wants to not destroy his life. So I thought about this question a lot. Are there any success stories that actually stick out above and beyond? And like I was saying, I care so much about all of my patients. I couldn't sit down and rack my brain over one in particular, because there's so many.
They've all been successful.
They've all been successful, yeah, they really have. Because people were in such poor ways as well. When they came to us, they really were put through the ringer. Many of the people, unfortunately, like we were just saying before about you've got to go through the mainstream and almost sort of like be nearly destroyed before you can come in. Unfortunately, people that have come here trying it, they were already in a pretty bad way. So it's pretty massive what cannabis does for them. It takes away that anxiety, it takes away all that medication. So you just see it in them. I've been properly humbled though. We've got patients that have Parkinson's, and when you see someone stop shaking after they have their medication, that's massively humbling. When you see someone and they come through the door and they're like, I wouldn't have been able to get here today if it wasn't for my cannabis. I can now move. Like I've managed to move here. Wow. I've managed to walk. I wouldn't have been able to walk here. I wouldn't have been able to come out of my house and go out into public. Now I'm here talking to you. So that's the most amazing thing. That's what keeps me going, are the positive stories from people and the humbling stories from people. And the surprise at how it's affected them strangely in other ways that it wasn't necessarily prescribed for in the first place.
Sure.
And that's another thing that I want people to really and I'd like the medical industry to focus on as well, along the same routes of like, do you really need two things to prescribe to someone when it's clear as day they're struggling with alcoholism and this is going to help them exit off that immediately? I wish there was just a bit more common sense around the prescribing of cannabis for mature adults that have issues that want to try it. En masse, cannabis is a relatively safe, is an extremely safe, it's an extremely safe natural thing. It's never killed anyone. Why are we so scared about letting people that are like really in bad ways try a bit of this, just because it might give them a little bit of, it might highlight their pre-existing psychosis? Sorry, what? How many other things are they probably taking that will do that as well?
Yeah.
Like, I get this fear of the psychosis thing with cannabis, with people, because it can, cannabis along with other things can exacerbate pre-existing conditions. So for the first time anyone tries it, there's always going to be that worry. And the only way that we can resolve that is making sure we don't prescribe stuff that's too strong too quickly. Well, chill, just have something that's low THC to start with.
Yeah.
That's the problem. Even the 19, again, our lowest THC normal cannabis would be like 19 THC.
Yeah.
That's probably too high for someone that's never tried it before, and it's probably way more than, like, let's say an older person would need that needs it to relax. So it's quite hard to find these balanced ones. It's quite hard to find low THC ones still within the medical industry, you've got to ask yourself why. And unfortunately, I think it's probably because there's not enough people getting given cannabis, because we're only seeing these acute people at the top. There's many people that would benefit from 8/8, the 50/50, over a much less severe condition. But we wouldn't entertain giving them cannabis, because you can only give cannabis to people that are like really bad, or let's go, well, okay, you suffer from migraines. Oh, why don't you just have this really low level cannabis, or try the gummies as a prescription? Why not try it? It's like, it's so inert compared to so many other things that like immediately can destroy your body. It just seems sad.
Let's flip the script on that then too. Have you had any patients come in with negative effects, or saying, this isn't working for me, it's making me feel funny, I don't like it, it's not for me?
Yeah. So yes we have. Yeah, I sometimes get negative effects if I don't listen to my body and I don't follow, and I don't get the medication that I should be getting. If I go, I do want to try something a little bit stronger when I don't necessarily need to, or I'm going to just try that terpene profile, that could really sort of mess me up. And then I know that, and I know how to self-manage myself with that much better, but a lot of other people don't. So yeah, I suppose the biggest example is it's actually usually the oils.
Okay.
Weirdly, the oils are through something that should be done sublingually under your tongue. You have to leave them there for quite a long period of time. I think it even says like 20 minutes or something like that. Most people don't. They put it under their tongue, they swallow it. That goes then through the GI tract. As everyone, or most people know that's eaten cannabis, it's a gamble then.
Yeah.
It could do nothing, or it could take you to the moon.
Yeah.
I, for example, don't even metabolize it very well in my stomach. It just makes me feel really funny, really weird, actually. So the most things are around. It's all about. I think the right word for it is titration or something. It's about how your body metabolizes cannabis. So I get the most complaints with the oils because of the issue with metabolizing. Right. and people getting a weird kind of on a plane but not a plane. They feel a little bit off, and it's within their body and stuff like that. The other thing is just it is that bit of anxiety, and people come to me. They say, "Look, I've tried this, and I've tried this new strain. It's given me a little bit of anxiety. What shall I do?" Firstly, don't worry, don't panic. Lots of people do get a little bit of anxiety about it. But what I'll do is, what we do is try and work with them. Let's not let's not go crazy and blame cannabis or say like it's definitely not the right thing for you. Because let's face it, if that were the case, I should have never been put on any of the SSRIs that I took, because the first time I took them, I was plunged into ridiculous anxiety. I couldn't even leave my room. Yet the doctor said, keep taking them. Keep out. Sorry, doctor, I'm literally panicking. I'm going crazy. Keep taking them. Keep taking them. So, to answer your question, yes, people have negative effects. They tend to be very small. They tend to just be low-level anxiety. Gave me a bit of anxiety. What shall I do? And the advice is up the CBD, because unfortunately, this medicinal cannabis has not been grown, in my opinion, very medicinally. It should have some CBD in it.
Yeah.
So it almost feels deliberate. It almost feels like, let's just make all of the medical cannabis for some reason devoid of CBD, when we've got a scientific understanding that CBD protects you against some of the negative aspects of THC.
Right.
Yeah.
So that's where I go to straight away. You're probably just having too much THC. Increase your CBD. Reduce your how much you have. Microdose. Have very small amounts. Some people can have a tiny amount of cannabis, and it makes them really, really, relaxed immediately. Some people need a load to get them on that. Everyone is so very different.
I mean, it's the same with even CBD, where some people take a low dose, 10, 15 milligrams a day, that works perfectly for them. Me, as an example, I take about 125 a day just for anxiety issues.
Yeah.
Just to keep me balanced throughout the day. So it really depends on the person and, again, how you metabolize it.
Yeah. But weirdly, so another thing that someone told me is that sometimes if they took too little, it made them anxious. So they had to take a medicated dose. So sometimes if you take a really small amount, it doesn't put you in a state of relaxation. It puts you in an in-between state, like a limbo, and you feel a little bit diseasy and uneasy. And that's what I think people get when they accidentally swallow their oil too quickly. They get this kind of uneasy limbo state. They're not sort of medicated, not medicated. So sometimes, again, you need to have the right dosage. The other thing, sometimes when you initially take cannabis, it does initially make you a little bit too overactive, and then it tapers off and it calms down.
Sure.
Again, a small side effect that for me massively outweighs any negatives. The positives outweigh the negatives. But yeah, these little negatives do happen, and they almost all are either around people coughing, people just like not vaporizing before ever, so saying, "Oh, this is hurting my throat," which again tapers off over time when you get used to it. Or there's other options. There's edibles. There's things like that. Or it's a little bit of anxiety.
Yeah.
We're lucky we've never had anyone that's gone into, as far as I'm aware, that's had a full-on episode that's meant that they've had to go to any A&E or something like that. Again, the way we try and counteract that is making sure that we don't overprescribe. And the regulation. What's the history of this person? Have they ever used this before? Have they ever used cannabis before? That's why a lot of our prescribers are much more comfortable if people have had cannabis before, because it's a you don't know until you try kind of scenario.
But I mean, that's the same on any drug.
That is the same on any drug. But by far and away, like a little bit of anxiety that wears off after a few minutes is nothing compared to months of severe anxiety that I received personally from my SSRI horrifying episode that I had. So yeah,
and
yes, I've been happy. I've been pleasantly surprised by how few
Right.
I was kind of expecting there to be a little bit more, or no.
And it seems to me too, like the few that have had the issue seems to be the same side effects over and over again.
Yeah.
Which to me says there's very, very small amount of side effects when it comes to cannabis compared to an entire page worth for a pharmaceutical drug.
Oh, pages and hundreds, yeah.
You know.
And the thing is, I mean, know roughly what they are. It's like, look, you might experience a little bit of initial anxiety. So take it slow, low and slow.
Yep.
Like everything. And it might just be that it's not right for you. You know, some people theorize that when you have cannabis, it does make your brain a little bit overactive. So you do focus on some of the negatives. And that is how you heal yourself.
Yep.
But that's a bit of a painful experience at first. To bring your worries to the forefront of your attention, which I think cannabis does, is how I think it actually helps a lot of people move through stuff by presenting it in front of and making you have to deal with it. Because I often get that when I first have a bit, all of those things initially come into my head, and then it tapers off.
Mm-hmm. I also think too we have to realize that, and even I do it myself. I tend to use the word cannabis a lot when we're talking about those kind of issues. But I think what we also have to realize is that majority of the time when people are running into these side effects or issues, it's not the cannabis plant itself, right? It boils down to that one molecule of THC.
Yeah.
That really does cause the anxiety, and it can cause people to feel funny and may not like that experience. As where CBD, CBG, CBC, CBT, these are all non-psychoactive components that have medicinal benefits as well.
Yeah.
So I think it's also, too, if somebody does have a bad experience with a flower or a tincture or anything like that, eliminate the THC and try some other cannabinoids and see how you get on with that. Because a lot of times, like I said, it's the THC that causes those side effects that people don't want to happen,
And when we've got an industry that unfortunately breeds for ridiculously high THC and no CBD, what are we going to expect? The regulations need to be on. They are not being tasked to grow these healthier strains because they know, unfortunately, that the people that do, and that's another thing, we've got to stop patients focusing on THC.
What's your highest THC?
What's your highest THC? What's your highest THC? So it's like, it's soul destroying. The number of times I've had to say, look, this is the highest THC. You don't want that. That's a horrible grow. It's dry. It's like, it's got the odd seed here and there because the poor plant's been like beaten to death to get you your 30%. The actual proper connoisseur themselves that grew it would have said, by that 19% THC, that was beautifully grown.
Exactly.
Beautiful terpene profile. The plant wasn't under any stress. When you smoke that, you will feel happy. And I honestly think that calmer plants that have been grown nicer actually have the similar effect. These supercharged make you they've, and God knows what they have to do to make some of them. They must put them under so much stress. I mean, you know more. I mean, they had to put like chuck sugar and chemicals at these things, effectively making the plant think it's about to die.
See, the thing is, like, the sugar depends on the type of sugar you use and how you use it. Like, I used to use a lot of molasses, right? But it's a sugar base, right? But a natural sugar, but it's not for the plant. It's to feed the bacteria in the soil so that they can turn around and feed the plant. So when you're trying to raise these THC levels, you're going to be using, most of the time, synthetic nutrients. Can you reach those levels with an organic soil grow? Yes, but that also depends on genetics. That plant is genetically bred to have that high THC. In a dirt grow, you may see that 27, 28, but then if you do with synthetics and start pumping it full of chemicals, then you might start seeing that 30%. And in my opinion, once you start hitting 30 and over, I would take that number with a grain of salt, because most of the time, those numbers just aren't real. When people are coming out with 35% THC, it's like you cut your top nug off, and did something to it to reach those levels, sprinkled some keef on it or something like that. But that's not the reality of how the plant is. Those are your top nugs, or they've been sprinkled with keef, as where your bottom layer of the plant, you're not going to have 30%. It's going to be a variety. So when you're testing these plants, you should be testing numerous buds from numerous different plants in that grow from top to bottom. And then getting an average of what that THC is, because it's going to be different from top to bottom on each individual plant. you know? So, yeah, I kind of went off on a tangent there myself, but
Yeah. But yeah, it's not all about THC though at all.
it's not.
And
Yeah.
and
It's
yeah,
a common issue. We even see this in the U.S. Like, if people walk into the dispenser, what's your highest THC?
yeah.
Give me your strongest indica or sativa, and it's like, you got a few minutes to spare, bud? Let's talk about this.
And then that's
You know?
again, often, I'll be honest, when someone says high THC, I immediately want to talk to them about THC, and I immediately want to talk to them about combustion. Okay?
Yeah.
Because, yeah, look, combustion's illegal. We all understand that it's illegal. But let's face it, probably in people's own private homes, the old school person is probably combusting.
Of course.
And probably because they think that it's making it stronger, or it's just how they used to do it. And I'm trying to educate people again. Look, I understand that you think that that's what you're doing and what you're achieving here, but you're not. Vaporize, get all of those other terpenes. You are throwing your money down the toilet. If you combust, you're just getting THC, and you're burning off. You're burning off all the amazing stuff that this plant does, the healing elements. You're burning them off, and then you're making it massively carcinogenic at the same time.
Yeah.
But if these people that went for the 30%, they go for 30% and they combust it, and it's so detrimental to their health. One, they're only getting the THC and none of the other good stuff that helps them. And two, it's really poor quality and really carcinogenic. And I don't think people realize you actually get more high off a really well-grown, high terpene plant. So if the reason you're going for THC is unfortunately because you just want to get more high, then that's still the wrong thing to look at. That's still the wrong way to look at it anyway.
Yeah. I mean, actually, a good example of that is a strain, it's at the Tokoloki Sherbert.
Yeah.
Right? You have a 19% and you have a 24%, the same strain.
Yeah.
I prefer the 19 because it has a higher terpene profile. And in my opinion is that 19 to 24% is not as significant as your terpene profile being even 1% higher.
Yeah.
Right? That's way more significant than that 5% THC difference.
Yeah.
And you're just going to get a better overall effect and better for an entourage effect.
Yeah. And that's unfortunately what's happening. People are getting really disappointed, and they're still dogmatically going for the 30%. They're like, oh, maybe that another 30% will get me where I want to go. Maybe that will get me where I want to go. And it's partly because probably their tolerance has built up.
Yeah.
They've never gone for high quality grows and good terpenes. So the medicine isn't working that well for them, and they need to start smoking medicinally with vaporizers, with high quality organic non-irradiated flower, with great terpene profiles. And then they need to be looking at what the terpene profiles are and how they personally react to it. And then they need to be communicating to our doctors how they react to it. Thank you for your initial suggestion of this one for my day anxiety. However, this one had a terpene profile that has made me anxious, actually. So it's done the opposite of what you prescribed it for me for, please. Do you think I could try this balanced hybrid indica for my day? Because actually, I think that is going to stop my anxiety, not make me tired, because it's a balanced, so it's got the pinene in, so it's going to be more focused. And that is going to help me. Of course you can.
Yeah.
There's a reason for it. You've explained it. And I don't see why a prescriber, once we get to that point, can't say, well, yes, try it.
Yeah.
The main thing, and I would be scared myself if I was a prescriber, is that first time. And we're really, really hot on that at Pura. We let people have 2 months worth of prescriptions, then they have to have their first follow-up. Then we're a bit more chilled.
Yeah.
But it's that first one. We've just prescribed you this. How did it go?
Yeah.
Mental health, is it you okay? Because it's just that first bit.
Yeah. But there's also that fear for the patient as well, right?
Yeah.
Unknowingly not knowing whether it's going to work or not, but then maybe finding, well, this strain's not working, that strain's not working, and now they're stuck with a bunch of it.
Yeah.
That's a problem too. I see with prescribing is that these buckets of 10 grams it doesn't work for people, especially going back to how things are prescribed. Indica for at night, sativa for during the day. Here's your indica for nighttime, but it's keeping that person up. Now they don't want it anymore, which also now contributes to the black market because now they're moving it or shifting it or treating it or doing whatever with it. Moving more to a model to where patients could actually try small amounts of these strains, finding out which exactly one works for them best without spending all that money and having a big tub of flour that's useless to them.
Yeah.
That way,
I've been racking my brain over this one because the best thing to do would be to allow people to try 1 gram.
Yeah.
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 And see how it affected them. But I understand why a doctor, for example, doesn't want people to be like, oh, I'm going to get a veritable smorgasbord of different stuff because, yay, let's just try lots of different things. It doesn't feel to them medicinal, but it is.
It is, yeah.
You have to try this. There's so many variables at play. You have to try that flower safely and see how those terpenes affect you.
Yeah.
And then educate yourself on the terpenes and how they affect you. And then move through your flower selection like that.
Yeah. Yeah. It's a much different thing to like when you're being prescribed like pills.
Yeah.
And a lot of times, yeah, you're like, the doctor's like, try this pill, see how it works. If it doesn't work, we'll try something else. But the cost of the patient's only £4. And for pills that may not work, that's nothing compared to what we're paying for cannabis prescriptions, right?
Yeah.
That's hundreds and hundreds of pounds that could go down the drain because something didn't work.
Yeah.
So that's where, I mean, in my personal opinion, the pharmacy aspect of it needs to be eliminated. I don't think pharmacies really have any purpose in this industry. It should be dispensary mode. Here's your cannabis card for the year. Go to dispensary, figure out what's going to work for you, and then keep going on with that. Come back in 6 months for a repeat or appointment. Let me know what is working for you and what strains you're using. So then that doctor can learn from that as well, without the patient having to go out of pocket hundreds and hundreds of pounds every month for that.
Yeah.
You can buy a gram for $5-6 and take it home and try it,
I think the reason...
massively reduce your black market as well.
Yeah.
I
I think the reason the medical industry struggles with that is it's so different.
Yeah.
So, like, going back to these SSNRIs again, you have to do them for a period of time, scientifically, medicinally, to be able to categorically say, yeah, that doesn't work for you, or that's toxic for you. You have to trial it for a period of time. And that period of time is months.
So they need to build up in your system.
Because it needs to build up in your system.
Yeah.
You don't need to do that for cannabis.
Exactly.
You can have one toke on that thing, wait half an hour later, and you've perceived how you've come up and then tape it off on it, and then how you now feel on it. Because there's that initial spike when you have it that everyone has, and then you are where you are. And you can do that very quickly, and you could do it over a very short period of time over multiple strains. But to a doctor, it doesn't compute very well, because it's like, I wouldn't do that with SSRIs. I wouldn't give them like 8 to try, and you can just have 1 pill of each, because that would be so detrimental to their health. But cannabis isn't that. No. Cannabis isn't an SSRI. It is a plant that just, when you vaporize it, gives you an immediate effect, and then the immediate effect goes off. And in that space of time, that needs to be translated somehow into the medicinal framework so they can deal with that. And it needs to be a basis, and it needs to come from a basis, I'm afraid, to be, the doctor probably at the moment needs to just give a dose and the strength. And then the terpene profile bit and what should be done at a click between a dispensary and the patient you can buy a couple of pounds worth and try it, and then hopefully you could then order the 10 grams when you know what you want.
Yeah.
Because you want to order. You don't want to have to order 10 different things every month. That doesn't come across very medicinal either. I do think people should find something that works for them, and then try and stick with maybe a few. Because again, I think it is also detrimental to chop and change all the time.
Yes.
And that's the other thing that I want to say to that. Again, I like patients to be able to specially order, but if they're just trying a different thing every month, they're not trying to heal themselves. Then at that point, then I'm feeling like, okay, you're just, and again, it's difficult because I don't have a problem treating it like wine, but we can't. It's not at the moment. I've got to toe the line of the medicinal, and ordering 5 different strains every month isn't medicinal ordering. But if you order, when I say ordering 5, then that 5 you might order again. So 5 that week, then you're going to do that. What I'm saying is, if someone were to order 10 over this and then pick 2 at the end of it, that's fine. But if someone were to keep ordering 1 and then leave it, and then what I'm saying is, there's no reason for it. That it's just for having weird and interesting flavors and things. But
From a medicinal aspect, I see what you're saying.
from a medicinal aspect,
From a connoisseur aspect.
but then that's where you're moving, unfortunately, into a realm that we can't talk. I can't really talk about too much, which is where I personally believe it should be. It should just be taxed. I believe as a 42-year-old person, I should have the civil liberty to try cannabis, try mushrooms, try DMT. I'm an adult person.
Sovereignty over your own
Provided I'm not harming anyone else, I feel like I should be able to do this. And I think it's horrifying that we're not. But at the moment, we're not. So I can understand why a prescriber would look negatively on patients ordering 5 that week, 5 that week, 5 that month, and then going back and ordering the same 5 again, and then switching and changing, and you can get it as well, because we're trying to say to the prescribers, prescribe carefully based on terpenes. So if they were to listen to that and say, okay, then again they could say, well, you're not doing that there, are you? Because that's 5 different terpene profiles. That's another 5 different terpene profiles. Then you're having that terpene profile again, and so you're not Mr. Patient now consistently looking at any terpene profile in any way, shape or form. And that's where I think, again, it's not necessarily the patient's fault, but that's where we might need to sort of say, well, look, why? And no, this is not. If you're wanting to do this medicinally, you should be really looking at the terpene profile and looking at why you're taking this. You shouldn't be picking it because of the name or the strength. Like, oh, that sounds like a nice name. No, I'd rather them say, and we've got some patients that do it. They say, I want to try that, Seb. Oh, how come? It's got this terpene profile. Great. Yeah, of course you can. There you go. I want to try that, Seb. Why? Because it's strong and it's a nice name. Why is that going to help you?
People need to realise that this is toeing the line. We need to toe.
We do need to toe. We do need to toe. Yes.
And we're at the crossroads now where we need to toe the line on medicinal because it's where we are. But if you want to have the choice, you need to push for recreation.
Yes. Yeah.
That's kind of where we are.
We've got to toe the line for medicinal, and it needs to work well.
Yeah, absolutely.
And then someone can have the argument and say, "Wow, this has now worked well." But of course, that can be recreationally legal, considering you can kill yourself on alcohol now.
Yeah.
You can't. I struggle to justify how you can make alcohol legal with all the stuff it does to society, yet you can't make cannabis legal based on. Sorry, it doesn't do all of these horrifying things. Don't get me wrong. We shouldn't be letting children do it. That we're all understanding. Let's keep it away from the children. Let's wait till your neuroplasticity is, your brain's developed. But after that, I think there's a civil liberty question to be had. But we've got to toe the medicinal line, and we've got to toe it correctly and well, and we've got to show society and show the naysayers that we're doing good work and we're healing people, and we are, and they can't hide from it. And that's what I'm passionate about is keeping on talking about the positives and the negatives as well, and how we can counteract the negatives. Because going back to your question, do we get negatives? Yes, we do, but we work through them very quickly and very easily. And for the most part, people remain on cannabis, even if they initially had a detrimental effect on it. That wouldn't often be the case with other medicines. It'd be like, you reacted badly to that and never take that again. That's a bad sign. If you react badly to that chemical, that's dangerous, but it's not so with cannabis.
Just change the strain.
Yeah.
See if that works.
You change the strain, just change the amount, just the dosage. I think half of it is because some people, I see it between one patient and another. Another patient, you can see that they're not taking the mick, but they need quite a lot to get them up to a certain level. Whereas someone else, really, 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 even though I've got some patients that have been on our books for years, they still only need a tiny amount because it impacts them so much. And what if those people dogmatically just took their gram a night that they were prescribed? That would be way too much for them. They need literally a tiny pinch. But most prescribers probably would have overprescribed even to them. 10 grams often would be too much for them. They need 5 grams a month.
Yeah. So you actually, because obviously at the 420 event which we had this year, you had some fantastic statistics which came out of Pura. Are you still keeping those statistics going? And is there anything you've added to them as well?
So since then, there's an audit that our prescribers do. And it's an ongoing audit that we are always doing in the background. But on top of that, we have now adopted follow-up consultation questionnaires.
Okay.
We want to start getting facts and figures around those and bumping that out a little bit, because the main reason is one, we want people to hear about it, and what's interesting is what it does do, the side effect, the positive side effect of cannabis. Like I was saying before, you often find that people that are taking cannabis for back pain end up quitting alcohol as well, and quitting smoking cigarettes. And suddenly, the prescriber's like, oh, they're asking a question, they're talking to their patient, they're like, yeah, I just decided to quit alcohol the other day. Really? So the GPs, it's becoming very, very motivational for GPs, because unfortunately in the mainstream, GP practices, they're getting lots of negative feedback from their patients. You're not healing me. I'm getting sicker. This isn't positive. Whereas in this thing, I'm getting better. I'm getting off alcohol. I'm getting off these toxic things. And then in my case, I'm now weaning myself off the cannabis too, because I would like to not have to medicate with anything. I would like to have cannabis as a glass of wine in the end of the evening instead of and not have to have any medication, because I have sorted out my issues with my health, my mental health. A lot of it was diet. I was eating and drinking crap. So the cannabis has allowed me to focus on that now. So it's just amazing. It's amazing. The reason we want to get these statistics out there is to show society the other benefits. If you get that person off alcohol, they're going to be also off your doctor, off your hospital, off your jail. And they are all taxpayer money things. That's why we need to do these statistics. And that's why I want to keep doing it. I think there's enough evidence, and it's so blatantly obvious already, to tax this and to regulate it and to give it to allow adult human beings. Make the age 25. Who cares? If neuroplasticity stops at 25, make it 25. 25 is your age, whereas an adult person, you can take anything. Anything natural, let's say, except for not synthetic designer drugs, because they are very dangerous potentially. But any natural plant, mushroom, whatever, over the age of 25, you should be able to take that.
So with your patients, how are you supporting them with any or navigating any social stigma that they may encounter as a cannabis user?
That's interesting. They do experience social stigma, and it's hard. It's terrible. All I can offer is none. No stigmas, no preconceived. All I can offer is open respect to listen and hear everyone that comes in. I openly talk about it to anyone and everyone, whether they're staunchly against it, staunchly religious, think that literally the devil created it. I will go and talk to them and say, look at me, I do this in my shed in the evening. It's locked away. It's away from my children. It's away from my house. This has changed my life, and this is positive. The only thing that we can all do is talk about it openly, in a positive and or negative light. Just openly talk about it, stop demonizing it, and give people the respect. So by doing that, I've had a lot of people say, wow, oh, it's so nice talking to you. I feel like they often come here specifically so that they can openly talk about it, because they very much feel that. And it's interesting. I've had a few people coming back to me saying that they're struggling in the workplace. They are, because they're medical users, they are struggling in the workplace with people thinking that they're wasters. because they're having to go to their employees and say, look, I've got a medical cannabis prescription. I need to medicate. I need to medicate in a smoking area or someone like that. I actually just spoke to someone in human resources that has just had to go through this within their company.
Mm-hmm.
They've actually in their company to allow for cannabis medication. And it's cool. And it's highlighted how ridiculous their existing education, existing legislation. They sort of started looking at their rules and regulations within business, and they're like, wow, we're like old-fashioned. You know, we're still like the weird war on drugs kind of thing. You know, similar to your chap from the Jersey. You know, this is still a poison, isn't it? No, it's not. It's not still a poison. Yeah. You know, so these kind of things were still written within. So it's interesting that the workplace is having these troubles as well. Yep. And again, I went straight at this lady and said, I bet you think that this person has their medication and they just sit at their desk stoned, don't you? And she was like, well, kind of, yeah. That's what a lot of people are kind of thinking, well, how are they going to be able to work? They're going to be half-baked. It's like, you don't really understand why they're taking this, do you? Exactly. Let's take this person, for example. They've got ADHD. They've got no dopamine or norepinephrine. They can't focus. They probably sit at your desk and desperately trying to drink coffee and sugar to focus on your work. They go up to their break room and they have a bit of cannabis. They wait 10 minutes. They can now focus on your work. Yep. Why don't you just look at their work instead of what they're doing, what they are, whether they're smoking cannabis or drinking coffee, or they've got a needle in them with sugar or cocaine? You know, why don't you just look at their, you know, how well they're doing, and how well you've allowed them to medicate, or, you know, and to do the other bits that an ADHD person might want to do, like take a break every 45 minutes. Yeah. You know, yes, they're taking a break every 45 minutes, and not everyone needs to do that. But when they do come and sit down for their 45 minutes of work, they hyper-focus, and they probably do twice as much as someone else that doing that 45 minutes. But to do that, they need a 15-minute break every 45 minutes because their attention can't do it. Let them do it, and suddenly you've got the best worker out of the bunch. You've just tweaked the way that you have dealt with them as a human.
Yeah, I agree what you're talking about, and I hear this a lot about the stigma in the workplace.
Yeah.
I also hear from patients about the stigma of consuming publicly. So, I mean, I have a lot of people come to this lounge specifically to medicate on their lunch break, or if they step away from work, because they don't feel comfortable doing it there. They don't feel comfortable doing it out in public. So we offer them a safe space.
Yeah.
To come here, to talk about it, to use it, to medicate, to enjoy it, and then go back to work. A lot of people who come here, their jobs don't even know that they use it.
Yeah.
Right. And they go to their lunch breaks, they come here, and then they go back to work. They still have their jobs. They're productive. You know what I'm saying? But yeah, that stigma for patients not feeling comfortable in the work environment and not feeling comfortable to consume publicly, in my opinion, is a problem.
Yeah.
And that was one of the main drivers for creating the space here, is so that people can feel comfortable and we can normalize this, right?
Yeah. Yeah. It's such a shame. I mean, I know people that literally wouldn't subscribe to your Facebook page, even though they are a cannabis, supporter and a patient. They don't want it on their Facebook page because they're so scared that someone in their office will realize that they're a supporter of cannabis. Yep. And they're genuinely scared that they'll lose their job because of it.
Quite so.
And unfortunately, we do have some extremely intense religious people on this island that flat out just literally do think that is the devil, and they will not entertain any debate at all.
No. I mean, we ran into this at the Vale Earth Fair when we were doing our interviews. Some people said, as much as I want to do this interview, I can't do this interview because of my job.
Yeah.
And because of what people would view me at on social media and so on and so forth. And just
the fact of the creative issue. As many people as we, the fact of no, they can't do it.
Yeah. Yeah.
And I mean, I don't want to be nasty to those people, but they are part of the problem. But then it's not their fault necessarily. The problem is part of their problem, if you know what I mean. But I would try and encourage them to be brave and tell everyone about it.
Yeah.
Because people need to hear about it. If people keep not telling everyone about the positive aspects because they think that they're just going to get judged, then it's never going to change. And they are continuing the problem. You know, I bet, and like I said, I say it to everyone, and I do get a double take every time. You know, when I was talking to directors and stuff in the finance industry as a compliance consultant, you know, saying, by the way, just so you know, I do this, the disbelief in eyes is shocking.
Right.
And are you really that ignorant? Do you really think that people that have a bit of cannabis medicinally in the evening to deal with this and this, do you really think that's detrimental to society? And do you think I'm suddenly going to turn into a complete joke? How? Why? Like, it amazes me that that people actually don't know that much about it, that they come to that conclusion in the 21st century.
Last question for you is the future of the medical industry. Obviously, there's always going to be medical benefit to cannabis, no matter what the status of what the legal or medical. There's medical benefits regardless. The actual medical industry itself, where do you see the future of that when a adult use market comes in?
I think that the adult use market needs to come in, and I think already the medical industry is trying to exit cannabis. I think they tried to incorporate it, they tried to make it Sativex, they tried to synthetically make it. Those are some of the things that I believe killed people, actually. The only time that you can say that like cannabis might have harmed someone was the synthetic version that humans created, that you can get through the NHS system for £4 a prescription for very certain things, a synthetic cannabinoid. So what was the question? It was, so I think that the medical industry has already realised that it can't tame nature. It can't patent it. So it's what we're in now is the trial of the medicinal industry thinking, right, can we do this? Can we patent this? Can this work? And I think they've probably realised that it's not, and it'll end up going the way that it has in the US. The way the medical industry probably wants to try and disconnect from it because it just is never going to fit their remit. It's a shame, but I also understand it. There's so many variables at play. The way the medical industry works doesn't compute with that. It computes with synthetic drug, cannabis. You know, this thing here titrates into your system like this exact timing. You know, it's got to be like that. The medical industry, and rightly or wrongly, that just does not compute to cannabis, and I don't think it ever will. So trying to tame cannabis for the pharmaceutical industry is never going to work.
Right.
This I just see this as probably the big money to make sure they don't lose money at the moment. And then when they can make sure that they're the ones growing the flower for the recreational market and make their money again, then people will be happy again. So I actually don't. I think that it unfortunately won't remain in the medical on the medical thing, and on the follow because the medical industry, and unless the medical industry completely changes how that works, completely changes, it's completely broken.
So from my understanding with it, the way the medical would work is literally that pharmaceutical company has to compound, we'll use THC for example, has to pull all that THC out, compound it down, and then show that this particular compound, it tackles these ailments, but a specific ailment. So you can't have something that creates an entourage effect, right? Because
you
does
can't
too
do
much.
it with cannabis because it's a psychoactive drug.
Down to be licensed medication.
Yeah.
And we've seen this in California years ago, early 2000s. So California's had medical since like 96 or 98. And I used to live in Florida, and I had a friend down there whose grandfather lived in California, who was being prescribed pharmaceutical grade cannabis pills called Marinol.
Okay.
Right. Play off of marijuana. Yeah. And it was just these little orange, like, gel-type capsules with a liquid in them. And people were getting sick from these. So they stopped it. They got rid of it. There's another one that's out going around now called Epidiolex, which is supposed to be a pharmaceutical-grade CBD.
Yeah.
Right? Which...
Yeah.
Right? That shows that it has adverse reactions as well. The pharmaceutical industry is trying, and they're struggling by trying. They're coming to that realization that it ain't going to happen. The only way forward is an adult use market, and for it to be treated like alcohol.
Out of interest, were these relatively recent things? Some of these newer ones?
The Marinol was years ago, early 2000s. The Epidiolex is more recent.
So they're still trying.
So there is a study, and people can put in the comments and correct me if I'm wrong, but from my understanding, there was a study that was done with Epidiolex that used children that had like the Rett syndrome and seizure issues. And they were using Epidiolex to obviously reduce those. And finding out, it was working. But what they found during that study in particular, that 13% of those children had adverse reactions to it. 2% of that 13% had adverse liver reactions. From my understanding, the anti-cannabis groups and a lot of the anti-cannabis doctors took that information and ran with it. And started
for cannabis as a whole,
running out there saying CBD causes liver issues.
No, a synthetic cannabinoid that you've created that your body doesn't have a clue how to metabolize and cause damage in the liver. Yeah.
And that's only based off of 2% of that 13% of kids during that study, of the 13% that had adverse reactions. So, yeah, I think media and a lot of people have ran with that saying CBD causes liver issues. I think that's part of the reason why the UK decided to drop the daily milligram dosage from 70 to 10 milligrams, which I would love to see the research behind that. 10 milligrams may work for some people for some conditions, depending on how sensitive you are to cannabinoids. But like I said earlier, I take 125 milligrams a day just for my anxiety.
Yeah.
So to say that, to reduce a milligram of something that you don't have enough research on, and you're using add research and studies to make that choice and make that decision, I just, yeah.
Yeah.
And then now you have other cannabis companies out there that are putting that on their websites and pushing that narrative that CBD causes liver issues. There's no research behind that, real research behind that,
I think the industry is panicking. When patients go onto cannabis, and I probably shouldn't say this because it'll maybe perpetuate it, but people then don't go to their GP as often.
Yeah, true story.
They just don't, because they don't need to.
Mm-hmm. It's an all-rounder.
It's a bit of an all-round for lots of other things, and that's as a side effect. Now you can't prescribe it to someone as an all-rounder, but then that highlights why you should be able to, because you give it to people for specific things that they are able to have it for, and then you find out that in nearly every case it has also had this side effect. Why can't we treat people with that side effect then, if that's what it has?
Yeah.
Oh no, it's not big enough, it's not a good enough thing. Yeah.
That's unfortunate, but
yeah, unfortunately, cannabis is a natural health product, and natural health doesn't go side by side with the pharmaceutical industry.
And that's
they clearly know how powerful it is, that they have been trying to incorporate it. This is to incorporate us clinic alongside the mainstream clinic. That's a soft attempt at bringing cannabis prescribing into a mainstream format. If that was set in there, it wouldn't be that hard for then a GP to suddenly do that. But they're not doing that.
Yeah. Why?
Because it's not compatible, maybe, with anything to do with the and no one's going there now. They're coming here. But industries are now losing money, so they're going to try and attack it.
Yep. I mean, at the end of the day, too, it's being treated like a pharmaceutical.
Yes.
And it's not.
It's not.
Right.
It's not.
You have to grow it in these GMP facilities that are made for pharmaceutical grade compounds. It doesn't make sense to me. It's just not.
It's a language. It isn't. It's trying to make
more
something a language that isn't. It's not that.
Right.
It's never going to be that language. It's natural.
Yeah.
You can't turn it into a robot. Stop trying to turn nature into a robot.
It's
You're into a robot.
maintenance. Does it help to cure some things or alleviate some things? Of course. But so does other plants out like lavender.
Yeah.
We know lavender to help with things, calming effects and stuff like that, and has therapeutic properties. And that's where cannabis, in my opinion, lies. It lies in this fine line right in between being medical and therapeutic. In no way, shape, or form would I consider cannabis to be pharmaceutical.
No.
Right.
No. And I would say to someone categorically, cannabis was not the one thing that changed my health journey. It was diet. But cannabis was the starting point, the catalyst to allow me to end some very toxic relationships I had with some very toxic stimulating things, which was alcohol and sugar, and sugar. And I ended up being able to see the wood through the trees, and now I'm being able to put myself on a health journey, with something that many people perceive as being a very unhealthy drug that's going to somehow turn me into a non-productive member of society. Quite the opposite. And that's the other thing that we're seeing: these people that were alcoholics, were opioid addicts, now becoming members of society with cannabis.
Yes. Yep. Which does allow for, I believe in one of the interviews we did, one of the guys had mentioned about people now being able to use cannabis, people now being able to, because now it's normalized them as their issues, and they're actually able to go back to the workforce and actually contribute to society, right?
Yeah.
That's a great benefit to have. So, it just proves that point that you said.
Yeah. More people just need to talk about it.
Yeah.
I think
Yep.
positively, or not too hysterically either way.
Yeah.
It's got positives and negatives. Just talk about it.
Yep.
Don't be too extreme. And unfortunately, you only hear the extremes,
You do.
and that's what's in. And that, unfortunately, in this day and age, that's what the media puts in front. They don't report on the facts. They chuck a few facts in there, but they just hystericalize everything to make to get the views.
Yep. Agreed. Even here, like even with the podcast, the shop, me, myself, us, we all pro cannabis, but we're not blind to the negatives of it, right?
No.
So it's having that open conversation with like-minded individuals, having that conversation with unlike-minded individuals as well, to hear their perspectives and their experience, which usually turns out to be kind of negative from their pointers out to be. There is some negative aspects and some to that. We're more than open to talk about that as well.
Yeah. That's the problem with this. With unfortunately, everyone in the world, unfortunately, does one in the world how it pertains to them a bit too much, and doesn't think or imagine that someone could have a completely different reaction to someone else. Like, look, I'm sure some people have had some horrifying experiences when they first try cannabis. I know they have. They could have been well avoided actually, but they happened. And that's reality. You have to accept that these things happen, and you need to talk to people about them.